As HIV and AIDS pandemic celebrates 39 years of infecting and affecting Ugandans, reports coming from the HIV and AIDS stakeholders indicate decreasing AIDS-related mortalities and an increase in non-communicable diseases. Uganda has made a lot of progress in the fight against HIV and AIDS, which has led to a reduction in the country's HIV prevalence rate from 18% in the 1980s to 6.2% currently.
What has happened is that ever since they adopted the policy of test and treat in 2016, many of the people have gone on to ART, that is antiretroviral treatment. And that has translated into many people now not dying but having the will to live.
As persons living positively with HIV remain on antiretroviral therapy, aging coupled with lifestyle put them at risk of developing non-communicable diseases.
One of the issues I've noticed, of course, is that as you live longer, you get my age, I'm over 60 now, you are in the range of what they call non-communicable diseases. Now, non-communicable diseases mean opposed to HIV that you cannot transmit them. And we are talking about diabetes, we are talking about high blood pressure, we are talking about cancer, we are talking about even mental illnesses like depression.
The burden of hypertension and diabetes is on rise and is occurring alongside a high burden of HIV care and treatment. According to World Health Organization, each year more than 15 million people die from NCD between the ages of 30 to 69, and 85% of these premature deaths occur in low and middle income countries.
Diabetes and hypertension are chronic illnesses that need lifelong treatment. And if these conditions are not managed very well, people go on to develop complications such as kidney disease requiring dialysis, strokes. They go on to develop blindness. Some develop foot ulcers that never heal, and they require amputation of the foot.
The management of NCDs includes detecting, screening, and providing access to palliative care for people in need. Leveraging the existing HIV infrastructure for NCD care is feasible with various approaches by the Ministry of Health.
That has translated into many people now not dying but having the will to live. So people are no longer dying from HIV. Could be dying from stress, could be accident, could be actually non-communicable diseases. That is why we want to integrate it.
Wakiso Health Center 4 is one of the pilot centers where HIV and NCD treatment is being integrated. The benefits of integrating HIV and AIDS care and treatment and non-communicable diseases are immense, according to a clinical officer at Wakiso Health Center 4, Nakiseka Mary Margaret. There has been improved service delivery.
Now, since all clinicians who sit in a chronic care clinic, when you are off, you're on leave, work goes on smoothly because the one at can see all the patients. The one in NCD can see all the chronic care patients. Another thing to the patient side, it has reduced their transport costs because they need one day to come for care for all the three conditions. So to me, it has done as well. The study has done as well.
At Wakiso Health Center 4, the clinical day for HIV and AIDS and non-communicable diseases is the busiest. By 8 a.m., all the seats are full, but the patients are happy. Some with more than one complication used to come more than once. Now they come and receive treatment once.
Nzize wano ku bujjanjabi sukali ne pressure. Naye nga kliniki eno tulina appointments. Olwaleero yebadde appointment yange.
Integration is holistic. Actually, for full integration, it must be cutting across from all stages of care, from the time the patient reports to the facility to the time he departs with medication. So how are we integrating? This had to be revised at each stage of patient's care, from the time of waiting area, to triage, to clinical room, to dispensation area and departure. So this had to be revised in a stepwise kind of flow.
The initial stages of integration of the three chronic conditions were not easy. Patients needed counseling and guidance to avoid being stigmatized.
Actually, elderly, they are 45 and above. So integrating these two cluster conditions or class of diseases initially rose some kind of concerns about stigma, because you may find the HIV patient actually has the mother-in-law non-NCD or non-diabetic. So bring them together. For patients that who hadn't done a disclosure, it seemed kind of tricky for them.
The cost of care for NCDs is very expensive. Patients with non-communicable alignments have to survive buying most of the drugs themselves. This is more challenging to the integration, with HIV having goodwill from donors and government.
Nti ffe kubanga tugenda kubeera ku ddagala ebbanga lyonna ate ne tusigala nga tufulumya, twalisabye naffe tuloozebweko nga aba ati bwe baakola ki, bwe baba providinga n'eddagala ku bwereere.
Abantu ffe bangi simanyi naye nga eddagala lya bbeeyi. Bajja ne bali kuwandiikira ne bagamba eddagala oluusi tewali, ne bagagenda olirule.
Wabula ekisinga ate okutunyigiriza ffe abalwadde b'ebirwadde ebyo, gavumenti eringa etatu.
The only challenge we have is that ARVs are available free of charge, while the other ones people have to buy. So someone is getting this and is not getting this.
According to research carried out by the Medical Research Council and Uganda Virus Research Institute, the occurrence of non-communicable diseases, conditions and mortalities need concerted efforts and dialogue to address the silent killers. The Ministry of Health is soon coming out with a policy for integration.
Needs to make sure that those are looked at, but we think that if this integrated approach works well, we will work at the policy level to make sure that we do more integrated care for our patients, so that we update the guidelines, we update the policies to ensure that this becomes standard of care.
Diabetes and hypertension, if not handled very well, they result in two very bad complications. The deaths from diabetes and hypertension are already at the peak level of death that were seen with HIV in the early 1990s. And these numbers are rising. We must address access to health, cost of care, patients with chronic conditions. Report compiled by Douglas Setumba.